Right now, Portland area emergency departments are struggling. Put simply, there just aren't enough beds in emergency departments to serve the community. And here to talk about the need is Jessica Monego, Providence Emergency Services Nursing Director, and Ray Moreno, Providence St. Vincent's Chief Medical Officer. Welcome.
Hi, thank you.
Okay, thank you for being here, but this is a serious problem. So what does a lack of emergency department beds mean for patient care?
For patient care directly, it means that we're seeing patients in alternative care spaces. We're seeing patients in hallways. We've converted vending machine boxes or spaces into care spaces.
Wow.
We're seeing them in recliners in non-private care areas. It impacts our wait times. It impacts the patients that actually come to the department and leave without being seen, and delays their care overall.
Yeah, Jessica, you summarized that beautifully. It's not what we aspire to, right? Mm-hmm. It makes things slower, it makes things harder, it makes it less private, and it means that we can't kind of get your care done as efficiently as we would like.
Sure.
So it's not what we aspire to be.
Yeah. So you're expanding the emergency departments at both Providence Portland and Providence St. Vincent Medical Center. So what is happening at each?
Okay.
For Providence Portland, we're expanding by 23 beds. We're creating an entire second floor with 20 spaces that are new to the department. We're also creating consult rooms for privacy with provider discussions, sub-waiting rooms where patients can wait for their results in a private area, and also influencing the safety of our caregivers and our patients.
Yeah, and we're doing many of the same things. We're going from 58 beds to 84 spaces. We've reconfigured the entrance altogether. We're actually moving where it is, which is allowing for line of sight as folks come in. We're re-engineering the beginning of the care in an area we're calling arrival care. We have flexible rooms. We've also added diagnostic capacity. Many people who come to the ED need advanced imaging studies, and we had one of those in our existing department at St. Vincent, and now we're gonna have two. And those tests can be a bottleneck in the middle of the day, so it'll help us get people through and get the tests they need more quickly.
Yeah, talk a little bit more about how these unique features of the expansion will make a difference for patients.
Yeah, maybe flexible rooms is one of them. So the ED can be a busy place, and sometimes we're taking care of adults who need a lot of medical procedures and lab tests and monitoring equipment. Sometimes we're taking care of little kids. Sometimes we're taking care of folks who are having a behavioral health emergency or crisis. And the space needs to adjust to that. So I think both of our departments have designed flexible spaces that allow us to take care of each of those patients optimally. So we actually designed it that way so the rooms can transform.
Oh, okay, yeah.
I would say in addition to that, one of the biggest features is our patient and caregiver safety. That's been a huge need within our community for the patients that we see that come in with substance use disorder or behavioral components. We need to make those spaces flexible, but also secure and safe. So a lot of the design has been influenced by our caregivers and promotes that safety and well-being for both patients and staff.
Yeah, well, talk a little bit more then about how this expansion does help your staff, the nurses, the doctors, everyone involved.
Well, it's in several ways. One is, as we're designing these spaces, we're keeping equipment and things in the same space in every room. So when you go in, you kind of know where you can expect the things that you need. That's one thing. Visibility and sight lines. We actually, as we were designing these, not only were we look at them on paper, we would mock things up to make sure that a nurse or a doc could see all the patients they're caring for as they look left and right. Equipment, monitoring equipment, communication equipment, all of this is being baked in to make the day-to-day experience of caring for patients more satisfying, safer, more efficient.
I would echo the efficiency piece too, because as we've expanded and been able to redesign the care areas, we've been able to overlay the workflows with that so that we can have vertical care spaces where patients can come through in a faster manner and have the teams there readily available with that privacy component on top.
Well, these are great projects, but also major expansion projects, right? So, I mean, what's the cost here?
Yeah, so it's a pretty significant project, yeah. So when we look at across both campuses for both emergency departments and also an expansion of cardiac care on my campus, on the St. Vincent campus, the project is $177 million. So it's a pretty big project. And thus far, a chunk of that, the majority of that has been supported by philanthropy.
Wow.
Yeah.
Well, how can people help then if they want to get in on the philanthropy as well?
Yeah, well, we're here because we're excited and proud about what we're doing, but we're here because we could also use help. So if folks want to help, I think one of the things that we think about is it happens to be in each of our buildings, but the emergency department is the anyone, anytime, for anything place to get care. We are a community resource. And by the time we add up the capacity at Jessica and Maya, both of our emergency departments, it's as if we're building another 50,000 visit emergency department somewhere in between the two.
Wow.
So it really is a community resource, and that's why we're hoping to get support from the community.
Yeah.
The community has played an instrumental part of this, and I feel extremely blessed to be able to work with Providence and the foundation team and seeing the philanthropy that the community has put forward.
Yeah, and the gratitude that we have for these folks. I mean, just the stories. I mean, this is probably the best part of our jobs is hearing from grateful patients, grateful family members who have the ability to help. And it all like comes down to a story with someone who took care of them. And that's pretty meaningful for us that people are willing to support us.
Yeah, no, that's great. And if you are interested in learning more and supporting these two major expansions, just visit that website right there on your screen, again, to learn more and to support if you are able. Thank you both for coming. It was great information to know and to learn. And yeah, can't wait to see the changes. Thank you so much.
Great.
Thank you.
Thank you, Lacey.